Hello, ladies and gentlemen, dear viewers and my colleagues. Today's topic is warfarin counseling. Warfarin is indicated in various health conditions. It is indicated for prophylaxis and treatment of venous thrombosis and pulmonary embolism, prophylaxis and treatment of thromboembolic complications associated with atrial fibrillation, and or cardiac valve replacement. It is also used for reduction in the risk of death, recurrent myocardial infarction, and thromboembolic events such as stroke or systemic embolization after myocardial infarction. So you can have an idea how important this topic is. When I started to learn about warfarin and warfarin counseling, I was very confused how to approach this station and what are the basic and essential information which I need to include and how I can remember this. After that, I try to make it simple, and now I will discuss this with you, and you will find it very easy to remember all the necessary information which you need for this station. So my approach is that begin with checking patient's understanding and knowledge, then explore patient's eyes, idea, concerns, and expectations. Next is exclude main contraindications, and if there is no contraindication, then explain about the medicine itself, what warfarin is, how it works, what it is used for, and how to take this medicine, how long you will have to take it, what is the dose in the beginning and how the dose is adjusted, what to do if a dose is missed, and what is an overdose. Next step is explaining about monitoring, why we monitor, how we monitor, what is INR, and when the patient needs to inform the healthcare professionals. Then counseling about factors which can affect INR, for example, certain foods and certain medicines. Then telling about the side effects. If a female patient of childbearing age, then you need to tell about pregnancy and warfarin. You need to give lifestyle advice. If patient is on warfarin, then you need to explain about anticoagulant treatment folder and how to use it, which includes information booklet, yellow record book, and an alert card. After that, you need to tell to the patient about some precautions while on warfarin and what to do if any of the following happens: bleeding, cut, headache, and trauma. Then you need to do safety netting and then closing the consultation. In this video, I will also give you some bonus tips about some additional information related to warfarin, what is Chadwick score, and counseling someone with learning disabilities. So guys, this video is going to be very beneficial, informative, and interesting. So watch it till its end and don't go anywhere. Let's start our warfarin counseling station. At the beginning of the consultation, check do you have any available information. For example, in your question scenarios, you need to check for patient's condition and why warfarin is being started to this patient, what should be the target INR for this indication. Then do grips as usual, greeting, rapport, introduce yourself, check identity, and after all, doing all these things, start by checking patient's understanding and knowledge about his or her condition and what are the risks involved with his or her illness or condition for which we are going to start warfarin, you need to check patient's understanding. You can ask the patient, you know what warfarin is and why has it been prescribed for you, and check patient's perception, ideas, concerns, and expectations. Very, very important for warfarin counseling stations. Patients have different concerns, different ideas. For example, patient may ask you why I have been prescribed rat poison. So you can address that, yes, that's right, warfarin first came into commercial use as rat poison and was manufactured for a completely different reason. But later on, its value for use in helping treat and prevent conditions in humans became known. Sometimes patient says that I don't want to take warfarin because my father took it or my uncle took it and then he had a head injury and had a severe bleed inside the head and he died. So you need to show empathy, and then you need to explain to the patients that at that time there might be some other factors, but nowadays we have very good system of monitoring, and we try to keep thinning of the blood in a range, and we keep supervising regularly. And you need to explain further that in case you have head injury or any bleeding, then you need to come immediately to hospital, and we have very good treatments available nowadays to control all these issues. So exploring patients' ideas, concerns is very, very important for this station. Then you have to exclude main contraindications to warfarin, which include hypersensitivity to the drug, esophageal varices, peptic ulcer, pregnancy. You cannot give warfarin within 48 hours of delivery or within 72 hours of major surgery. Cannot give warfarin in decompensated liver disease if platelet count is less than 50, in any bleeding disorder, and cannot give aspirin and warfarin together. So check for all these contraindications. When you start counseling about warfarin, you need to tell that it is a blood thinner to keep your blood thin so you don't have any clots in your blood vessels, and it inhibits by formation of active clotting factors, so blood doesn't clot quickly, but this blood thinning effect can be reversed at any time. And this is used to treat and prevent various conditions, for example, clot formation in your legs, in your lungs, and in your blood vessels going to your brain. And you can also explain that it is available in tablet form of different strength and different colors. For example, 0.5 milligram is white and 1 milligram is brown, and 3 milligram is blue, 5 milligram is pink. So you can explain these things. After that, you need to explain that this should be taken at the same time every day with a full glass of water, and for usually for day 1 and day 2, 5 milligram is given, and from day 3 dosage depends on the INR. And in the beginning, the dose will be changing from time to time depending on how thin your blood is, and afterwards the dose will be adjusted, and when correct dose is established, then it will be kept for the next few months. And people with DVT or deep venous thrombosis usually take it for 3 to 6 months. You need to explain this to your patient, and if a dose is missed accidentally, you can take the missed dose before midnight, but after midnight forget about the missed dose, and from next day continue with the regime as prescribed. And never take a double dose unless specifically advised. And if you have taken too much warfarin tablets or have missed any doses, you must inform anticoagulant healthcare staff. Important thing is to counsel about monitoring. Explain to the patient that dose of warfarin varies based on INR, and INR is international normalized ratio, which is a measure of how long it takes your blood to clot. In normal people, INR is 1, but for people at a high risk for blood clots, we want to thin their blood, and their ideal INR should be between 2 to 3. This will differ between patients and conditions. So whatever patient's condition or indication is, you need to explain what is the ideal target INR. INR 2 to 3 means it will take 2 to 3 times as long for the blood to clot compared to before. And in order to ensure that we keep blood within the necessary range, we will need to monitor INR regularly. And this is done through a blood test. How often INR is tested? Initially every other day until 2 consecutive readings are within range. And after this twice weekly for 1 to 2 weeks again until 2 consecutive readings are within range. Thereafter every 12 weeks, that is 3 months. And patients visit their Warfarin clinic for the blood test, and if they have blood test in the morning, the result will be back in the afternoon. The nurse from the Warfarin clinic will then ring them and let them know the dose they need to take and tell the patient when is their next appointment to have the INR checked. Advise the patient that they have to inform their pharmacist that you are taking warfarin. This is to avoid any drug interaction or to check for any contraindication. And advise the patient to inform their anticoagulant clinic if any other medication has been started by your GP or hospital, or if they start any over-the-counter or herbal medicine, including any vitamins. Vitamin E can increase and vitamin K can decrease the effect of warfarin. Why it is important? To inform your anticoagulant clinic because you may need more frequent INR monitoring. Next is give advice about the factors that can put the international normalized ratio out of range. These include medicines, foods, alcohol, and acute illness. So first come to drug interactions. Advise the patient to avoid aspirin or aspirin containing products, including cold and influenza preparations and topical salicylates. They should be avoided unless they are clinically recommended by a healthcare professional. And avoid certain painkillers, for example, aspirin, NSAIDs, ibuprofen, as they can increase the risk of bleeding. And certain antibiotics such as macrolides, anti-tuberculosis, and anti-epilepsy medications. All these have interaction with warfarin. Certain foods, for example, diet rich in vitamin K. Advise the patient don't make any big changes in diet, especially an increase in consumption of foods rich in vitamin K, such as broccoli, kale, and or spinach. These can potentially affect control of anticoagulation. And if you ever wish to make such changes, inform the anticoagulant clinic so necessary dose adjustment and monitoring requirements can be fulfilled. Cranberry juice enhances the effect of warfarin, therefore should be avoided, and grapefruit juice should also be ideally avoided. Advice about alcohol: limit the amount of alcohol to a maximum of 1 or 2 drinks a day within nationally recommended range, and never binge drink. If there are major changes in alcohol consumption, for example, if you stop drinking or start drinking more, then inform your anticoagulant team because it can affect your INR. Some other useful advices you need to give to your patient: that consider quitting smoking. This is to decrease the risk of clot formation if the patient is a smoker. And then advise on extra care when carrying out routine tasks such as brushing teeth or shaving or handling sharp tools, and advise the patient to use a soft brush or an electric razor. Advise the patient to inform the dentist while booking, just in case you need to stop the warfarin for a few days before a dental procedure. Then advise about general tips to prevent clots. For example, maintain a healthy weight, stay active and take regular walks, drink plenty of fluids to avoid dehydration, and don't sit for long periods for time. For example, on long journeys or air travel, get up and move around every hour or so. And do not cross your legs while you are sitting. It can restrict blood flow. Giving advice about anticoagulant folder. Talk about anticoagulant treatment folder and how to use it. Tell that it includes an information booklet, yellow record book, and an alert card. Information booklet provides a point of reference and reinforces all the information which are covered during the consultation or counseling, and make sure that all the fields are filled and then hand over it to your patient. Tell about yellow book or blood monitoring book to keep the treatment record. It contains information about dose and date of blood tests, test results, and other necessary information entered by the doctor or the nurse when you go to anticoagulant clinic, and advise the patient that you should always take it with you to each appointments at the anticoagulant clinic, and if possible to other appointments, for example to your GP, pharmacy, or dental appointments. Anticoagulant card, which is a card like a small credit card and can easily be carried. It is important in emergency situation to inform healthcare professionals like your dentist or any specialist before receiving another treatment. And it shows patient's details, and patient is on warfarin and date treatment started, the reason for treatment, target INR, and the name and telephone number of the warfarin clinic. This is an anticoagulant alert card. Next, you have to explain side effects of warfarin to your patient and risks involved. Explain that it can cause nausea, vomiting, and diarrhea, and the main side effect is increased risk of bleeding. Spontaneous bleeding may occur while on warfarin. This includes easy bruising, bleeding gums, nosebleeds, prolonged bleeding from cuts, blood in the urine or stool, coughing up blood, a subconjunctival hemorrhage, and vaginal bleeding in a postmenopausal woman can occur. If a lady is in childbearing age, then you have to tell that warfarin cannot be taken during pregnancy, and the woman must not become pregnant while taking warfarin because it is a non-teratogenic and can affect the baby. If necessary, discuss this with the patient and consider contraceptive options for women of a childbearing age. Also, for women with regular menses, any heavy bleeding should be reported to the GPs, and since the dose may need to be reviewed, or alternative options considered like change of drug or initiation of iron supplements. If she becomes pregnant or is planning a pregnancy, she will need to stop taking warfarin and to start using low molecular weight heparin. Next is safety netting about bleeding. Report any spontaneous bleeding that does not stop. As a rule of thumb, if there is a minor bleed, for example light nosebleed or bleeding from a cut, and this does not stop 10 minutes after pressure has been applied, the patient should seek medical help. Inform the patient about how to recognize serious side effects such as gastrointestinal bleeds and severe headache, for example subarachnoid hemorrhage. About bruising, tell the patient that the patient is more likely to bruise. They need to know this and be careful. They would be advised to give up any heavy contact sports, for example rugby or boxing. Patient should report any of the following: severe back pain, because it can be an indication of spontaneous retroperitoneal bleeding. Difficulty breathing or chest pain could be an indication of pulmonary embolism. Any symptoms that could be a sign of the condition that you are taking warfarin for. For example, pain in the cough, as this could be indication that the INR is not within normal required target range. And if unusual severe headache, a mild and simple headache, patient can take paracetamol, but in case of unusual headache, patient needs to see a doctor. And if you are involved in major trauma and you are unable to stop the bleeding, you should immediately report to A&E. What to do in case you require surgery? You may have to stop warfarin treatment temporarily. Most people do not have to stop warfarin for dental treatments. If you have a cut, apply firm pressure to the site for at least 5 minutes using a dry and clean dressing. If blood doesn't stop after 5 minutes, then please come to hospital. And in case of nosebleed, what to do? How to stop a nosebleed yourself? You should sit or stand upright. Don't lie down. Pinch your nose just above your nostrils, the soft part of the nose, for 10 to 15 minutes. And lean forward and breathe through your mouth. You can place an ice pack or a bag of frozen peas wrapped in a tea towel at the top of your nose. Go to emergency if your nosebleed lasts longer than 10 to 15 minutes. The bleeding seems excessive. You are swallowing a large amount of blood that makes you vomit. The bleeding started after a blow to your head and you are feeling weak or dizzy. or you are having difficulty breathing. So in all those cases, don't waste time and go to hospital. Next is closing the consultation. Ask the patient, do you have any questions? And if yes, then clarify. Arrange a follow-up appointment, face-to-face or can be telephonic. Also remind the patient to consult the information booklet in case they forget something, and check the patient's feeling about the warfarin now after that you have explained everything to them. If they are not still happy, then warfarin may just not be the drug for them. You can offer them other options. For example, NOX. I will discuss about NOX in another video. These include like drugs like apixaban, and you may need to explain pros and cons of apixaban if needed. Some additional information, as I discussed, that I am going to give some bonus tips. So contraindication of warfarin, absolute contraindication I have already discussed. There are some relative contraindication, and these require a careful balancing of the risks of warfarin against the risk of thromboembolism before making a decision as to start the drug. These relative contraindications include previous history of intracranial hemorrhage, recent history of a major extracranial bleed without known cause, history of peptic ulceration within the past 3 months. Wait until treatment of peptic ulcer is completed and continue treatment along with warfarin. Recent history of repeated falling episodes with a patient at higher risk of bleeds. Likelihood of poor patient compliance due to dementia or cognitive impairment when there is no caretaker available. Alcoholism, especially binge drinking, and hypertension, which is poorly controlled or not under treatment. So all these are relative contraindications. Now, how to manage high INR? If INR is between 6 to 8 with no bleeding, stop warfarin until INR comes down to less than 5. If INR is more than 8 with no bleeding, stop warfarin until INR comes down below 5 plus give oral vitamin K. If INR is 5 or more than 5 with bleeding which is not severe, stop warfarin and give IV vitamin K. If INR is less than 5 with bleeding which is not severe, you need to decide on clinical judgment. Consider decreasing warfarin dose and IV vitamin K. In case of a serious bleed, stop warfarin, give IV vitamin K, and you may need to give plasma complex concentrate, which is known as Debitrex. So now CHADS-VASc score. What is CHADS-VASc score? Here is a table. You can see the risk factors and scoring. And CHADS-VASc score is a clinical prediction tool for estimating the risk of stroke in patients with non-rheumatic atrial fibrillation. It is used to determine whether or not treatment is required with anticoagulation therapy. If score is 0, no anticoagulation is needed. If score is 1, in males, consider anticoagulation. In females, no treatment. This is because their score of 1 is only reached due to their gender. If score is 2 or more, offer anticoagulation. So CHADS-VASc score is used in non-rheumatic atrial fibrillation to estimate risk of stroke and the need of anticoagulation therapy. Now coming to Warfarin counseling to someone with learning disability, this is also a station in Plab 2 exam. Basic principle is that any type of learning disability needs extra help in administering warfarin. Even if it is only a mild learning disability, you still need to arrange for help in any form, such as a relative or carer. Ask the patient, will you be able to remember taking the medication at a particular time every day, or do you fear to forget to take medication at the same time every day? Ask if there is someone who can help to administer the warfarin at home. Do you have a relative who lives with you? Do you have a carer? And then explain all the points about warfarin as usual, but at a much slower pace. Explain to the patient, don't worry if you don't understand anything. Let me know and I will repeat. My all time is for you today to make sure that you understand everything as well. If you need to explain something difficult to patient, you can draw a picture or you can use any object to explain why we are using warfarin, what is a clot, what is a vein. You can show vein on your hand or arm and you can explain that when clot is formed inside it, then it can block blood supply and what can happen. So use all the tools to explain. Another important thing is that after explaining a few details, check understanding. So chunk and check more often and ask the patient to repeat anything that you tell him or her. But do not ask every sentence. Give some information and then ask the patient to repeat. If patient cannot understand or retain the information, it means the patient has learning disability. Very important that if the patient cannot even repeat the word warfarin, it means patient has severe learning disability. In this situation, there is no need to ask the patient to repeat the sentence. Explain to the patient that don't worry, I will write down all the information on a piece of paper and you can give it to your relative or carer. And if you want, I can explain all these instructions to your relative or carer as well. If there is no carer or relative available, then you need to refer to the social services to arrange for someone to come in every day to help with the warfarin medication. And in the meantime, the patient needs to remain in hospital until help at home is arranged. So guys, I have finished my presentation, and this information is for educational and learning purpose and not prescribe any treatment or procedure delivered by any of healthcare providers, and it is not a substitute for professional medical advice, and nor is it intended to be for medical diagnosis or treatment. Thank you very much. The end, and don't forget to subscribe to my channel and press the bell icon, and don't forget to forward to your friends for their benefits. Thank you very much, and see you with some more interesting information and some more interesting videos. Thank you and bye bye.